Hi, everybody. Thanks for taking the time to join me as we discuss the topic of the patient experience and how it came about. I think that learning a little bit about the background of why it exists, why it came to be part of healthcare, will help us to better understand its importance. Now, before we move any further, I learned about the patient experience in 2008. And whenever I bring up the topic of patient experience, these are the type of reactions I get. And trust me, I have had those same reactions myself in the past. But after years of learning and studying this subject, I can tell you now that it is a crucial part of my medical practice. And so please bear with me for a few minutes as we review the history of this important topic. So the objectives of what I hope we can accomplish in this review is we will use the five W's, when, where, who, what, and why, to review the history and the reason why the patient experience exists and is implemented. We will review a brief history of something called TQM, or Total Quality Management, and learn a little bit about the work of Dr. Edward Deming, Lean Systems, Six Sigma, and other quality frameworks. And we will review the origins of the quality movement in healthcare and something called the triple aim, and evidence as to why the patient experience matters. So, to give an initial background, behind the history of total quality management. It's a concept that arose when the Industrial Revolution brought mass manufacturing into our culture. Initially, quality, efficiency, and cost were new issues to be dealt with in these new companies, and a new economy really formed in this nation. People moved from rural areas to work in factories, and initially, you could order products from a Sears catalog, and you would get your fancy electrical vacuum cleaner, which would take about 8 months to ship to you, and it would be the talk of the town. But there was like a 30% chance that he could electrocute you. So there were issues initially that we had to overcome in manufacturing and factories. And by around 1911, a scientist by the name of Frederick Taylor publishes this landmark book called The Principles of Scientific Management. And what Frederick Taylor said is that we should develop a science for each element of work, for each area of production. We should apply scientific methods to select, train, teach, and develop the workers. We should also cooperate with the workers in how to improve their own positions, and we should divide the work responsibility. And we take these things for granted, but when we think about what we do in healthcare, these principles are applied, and they started with people like Frederick Taylor. We specialize in work areas, and we develop training and education based on these principles. And these new concepts helped industry to create safer, better quality products at a reduced cost. As time went on, by the 1940s, for example, vast knowledge had already been obtained and applied to manufacturing based on total quality management principles and statistics, new knowledge on human psychology, etc. And this knowledge really allowed the US to become a world power in just a few decades. For example, we went in just a single generation from the Wright brothers airplane to putting a man on the moon, and something that had never seen in previous human history. And then comes in Edward Deming, which was a mathematician, an engineer, and a statistician. And he was asked by the US government to assist with post World War II Japan reconstruction. And he brought these principles to Japan, and he brought his expertise in quality control techniques. And these were eagerly adopted by Japanese manufacturing. They took so readily to his teachings that they developed something called Kaizen, which in Japanese is a term for continuous improvement. And this brought Japan rapidly out of post World War II destruction to have them become a leading manufacturer empire by the 1960s, 1970s, and 80s. For his pioneering introduction and implementation of this Kaizen principle in Japan, the Emperor of Japan actually awarded Dr. Deming the Sacred Treasure Order in 1960. And as I mentioned, Japan became an economic world power in about just 20 years with unparalleled quality and low cost of production. But improved manufacturing and reducing cost was not the only issue that needed to be improved. Product safety became a top priority, as I mentioned in the example of the vacuum cleaner that could electrocute you. New practices came about like lean manufacturing and Six Sigma production, and these helped industries to make products safer as well as more economical. The aviation industry really applied these concepts heavily to make transportation safer from end to end, beginning with the production of aircraft to the safe delivery of passengers. In the 1960s and 70s, the federal government started to look at the aviation industry and at the application of quality measures in healthcare. The reason why was because they were paying Medicare and Medicaid costs, and they started to demand a certain quality measure for that payment and for the patients that they represented. So Congress established a set of conditions that they titled Conditions of Participation, which required the implementation of several elements that were absolutely necessary for hospitals to operate. For example, they said you have to have staff credentialing. You have to verify that doctors and nurses and technicians were truly educated and it wasn't a real education. You have to make sure that they're credentialed. You also have to have 24-hour nursing services, and you have to have utilization reviews, etc. By the 1950s, the quality movement in healthcare was rapidly taking hold, and in 1951, the Joint Commission on Accreditation of Hospitals was established to improve hospital quality. By the 1970s, the Institute of Medicine was created to improve the quality of healthcare. And in the 90s, the National Committee of Quality Assurance was established with an objective of improving healthcare quality. And it uses measures to measure this improvement with data from the Healthcare Effectiveness Data and Information Set, HEDIS, and also the Consumer Acceptance and Healthcare Provider System, or HCAP survey. So where does the patient experience fit in all of this? The best way to answer that question is to look at what is called the triple aim of healthcare. So we know that measures of patient experience arose from work in the 1980s, and they're now in wide-scale use. Back in 2001, the National Institute of Medicine issued one of the most influential framework, which included 6 aims for the healthcare system. It had to be safe, effective, patient-centered, timely, efficient, and equitable. And then the triple aim of healthcare took up some of those recommendations and introduced its framework in 2007. It specifically mentions the patient experience as a fundamental component of the framework, and we will see why. So let's briefly review the triple aim framework for healthcare and what it is. It essentially applies an integrated approach to simultaneously improve care, improve the population health, and reduce the cost per capita of that healthcare. There is a growing realization that the successful health and healthcare systems of the future will be those that can simultaneously deliver excellent quality of care at an optimized cost while improving the healthcare of their populations and not just the patient. I have attached a brief link to a video if you would like to learn more about the triple aim framework for healthcare. So we know now that one of the 3 elements of that triple aim is the patient experience. So how do we measure the patient experience? Through patient surveys, through the HCAP survey, through likelihood to recommend, through safety and utilization data, through peer review cases, through metrics like the key performance indicators that we use, for example, aspirin for chest pain, EKG time, hand washing, etc. And this brings us to the final question as to why. Why do we need a better patient experience? There's extensive evidence, and I have attached a link that you can click on That's a review of over 55 studies on this from multiple different journals and multiple well-controlled studies on this topic if you're interested. But this extensive evidence shows that a positive patient experience is positively associated with clinical effectiveness. So we're more clinically effective when people are trusting us and they're not upset at us, and when they feel that we care about them. It's also tied positively to patient safety. When we provide a better patient experience, there is better safety, less adverse events, improved compliance, better clinical outcomes, and reduced healthcare costs. The data that supports the case for the inclusion of the patient experience as one of the central pillars of quality in healthcare. It's just not some superfluous thing that we address. It is one of the central pillars and thus one of the three legs of the triple aim. It also supports the argument that the three dimensions of quality should be looked as a group and not in isolation. This all works together with the other measures and the other techniques that we discussed about. And in their opinion, the triple aim framework says that healthcare workers should resist sidelining the patient experience as being too subjective or mood oriented and divorced from the real clinical work of measuring safety and effectiveness. When we take this last attitude of saying, well, this is just nonsense, or this is just something that's just so depending on how the patient is feeling and is not real clinical work, we are really missing the point. Bottom line, when we provide a good patient experience, we are collectively helping to move the ball forward in healthcare. We are creating a better culture and a standard for future generations of healthcare workers and patients. Anyways, I hope that you have found this interesting and useful. Thank you so much once again for taking the time to review this important topic with me.